as we were discussing about the good laboratory practice in the last class, so to till we have reached the pillar of the good laboratory practices, right? What are the main pillars where the this GLP work out, that we are going to discuss in any laboratory, let it be the IICT or CCMB or IBHTU, yeah, the Himachal Pradesh, or many good laboratories which is central government. Let us take the example of them, how they are working and what are the main pillar for being activated, and these kinds of practice which is being successful in those laboratory. The GLP is based on four pillars which have to support the implementation and daily observance of its principles. So there are four pillars it has given: the management, the second one is the quality assurance, and the third one is the study director, and the fourth one, that is the national compliance monitoring authority, right? So these are the four main strength of the GLP that any of the good laboratory which they are adopting and implementing. So coming to the first one, the management, how they are going to manage the things in different level, in different steps of the lab. A management which is convinced that GLP is a good thing in itself, right? So whenever the good word comes, like, we are going to bother about the quality of method, quality of material, and quality of the finished products. Therefore, an essential management responsibility is the appointment and effective organization of an adequate number of appropriately qualified and experienced staff throughout the facility, including those specifically required to perform quality assurance functions. So ultimately, the goal is the quality assurance. We are going to assure the quality at each and every level. That's what we required qualified. What do you mean by qualified? Any work that is recommended into the laboratory, that work it is specified for the individuals. That's what qualification is very much important here, right? So whether the person who is employed to do that task, he is having sufficient qualification or knowledge or not. Qualification is the sense knowledge, right? Whether it is but the having the proper degree, diploma, or the education things which passing that particular person to do that work, whether it is there with him or her or not. That is we have to take care here to assure the quality. And the second one thing, it is the experienced staff, right? So uh, many people, they will be having qualification but they don't have experience. So experience is having also its own important, because it is all about the skill. You have knowledge but you don't have skill, then it is also useless, right? So knowledge and skill both are important. That's what the experience it should have in that particular field, in that particular task, right? So here the qualification is closely related to the knowledge, and the experience is closely related to skill. So knowledge and skill both is important to complete the task whenever you are functioning into the quality assurance parameters. And this management brings us to the second pillar of good laboratory practice, right? So that's what it is having its own important. The coming to the next one, that is the quality assurance. The second pillar of this building, named GLP, is the quality assurance, an internal system of assuring that the principles of GLP are observed, right? So coming to the first paragraph in this quality assurance here, the compliance with the GLP standards in the everyday work at a task facility can only be good as the critical observational capability of the quality assurance inspector, right? Inspector is the sense the person who is going to investigate at different types of steps, methodologies, technologies, tactics, all those things. On the other hand, and also only as good as the ability of the quality assurance manager to succeed in carrying through any objections to the way GLP is handled by individual persons, right? So the here two words they included, that inspector and manager, because it is not that it is, if the CCTV cameras are there, if other types of documentary they are maintaining, then also there should be the core team or core committee, those work only to check out what is going on, how is going on, and who are the person, how they're performing their duties, how, what kind of materials are being used, or what kind of methodology or techniques are being used. Somebody should check only. If nobody will check, how you will come to know the errors, how you will come to know the complaints, how you will come to know the what is going on wrong during the process, right? So that's what the quality assurance manager and quality assurance inspectors, they are the person who is having the responsibility to assure the quality and each and every steps. The second paragraph suggests that quality assurance may thus be regarded as the prolonged arm of management and exercise, which exercise its control over the GLP compliance within the test facilities. What are the test facilities are established in that particular lab? The management are going to exercise to control its different facility, whether it is working or properly or not, whether the things are going on properly or not. The coming to the next one, the study director. The third pillar of the good laboratory practice system consists of one single person. The study director is the one single point of study control and the one single person on whom the whole study hinges from the beginning to the end, right? So the director, study director, who is the person, who is the one designated person into the GLP, who is going to monitor that right from the beginning to the end products, what is the things are going on and how it is being controlled, it everything it is with the help of documentation, with the help of things going on, with the help of complaints coming, he is going to or she is going to manage the things from beginning to the end. The second paragraph, and study director, it suggests that the study director is usually the scientist responsible for study plan design and approval, as well as for the overseeing data collection, analysis, and reporting, and for drawing the final overall conclusions from the study. He is going to critically observe right from the material arrived, the process is started, the machineries, tools, the what kind of methodology they are using, what is the finished product, what kind of data came out, whether the data is significant or not, whether this particular things has been having any kinds of error or not. It is going to at last, after adopting this particular methodology, what is the outcome, what is the overall conclusion, whether process is succeeded, whether the finished products it is up to the mark, whether the finished products it is having all the quality parameter which it is supposed to, that the study director, it is going he is going to the conclude the things overall. Here, one example it has given that National Good Laboratory Practice, the Compliance Monitoring Authority. It is by the government, the Department of Science and Technology, Government of India, DST. They have given that National GLP Compliance Monitoring Authority was established by the Department of DST, Drug Department of Science and Technology. Right. So DST, it is the funding organization by the central government of India, which approval of Union Cabinet on April 24, 2002, right? So it started first, Union Cabinet of the Union Cabinet on April 24 in 2002. The provisional member of OECD, the Organization for Economical and Cooperation Development for Good Laboratory Practices. India is an observer to the OECD's working group on GLP. What is
Hi.
OECD, the Organization of Economical Cooperation Development? It is the one governing body. How this body it is working on to improve the or to facilitate the good laboratory practice throughout the country. The authority has trained 33 experts in the country as good laboratory practice inspectors, right? So those who are employed as inspectors, they are going to inspect the laboratory as per the guidelines given, and they are going to give the report or submit the report to the DST, and it is going to give the approval whether the lab it is fulfilling all the quality parameter requirement or not. If they are failed to fulfill that requirement, the body is going to cancel their license, body is going to reject their approval, and further they need to improve. Their body is giving the time to improve and try to fulfill this, then only we are going to further extend your license. The National Compliance Monitoring Authority, it is the National Compliance Monitoring Authority for the international recognition and mutual acceptance of studies and test data. Okay, so what happened here? The NCMA, that is National Compliance Monitoring Authority, that is for the international recognition of mutual acceptance of studies, right? So whatever the data is being collected from the laboratory, for that, whether they are having a proper acceptance or not, whether they are going to get the international recognition or the proper their popularity at international level or not, that is the body is going to monitor. This recommendations sets out the basic characteristics of the procedures for monitoring compliance with the good laboratory practice principles, and also following these recommendations, two guidance document on compliance monitoring procedures for good laboratory practice, and on the conduct of laboratory inspections and study audits. How this inspection study audit, the audit, they are going to just check critically the documentation which they have recorded during the procedure, during uh, the lab going on, that they are going to audit, and both directed at the national monitoring authorities were issued, right? The third line in this slide, it is suggesting that this fourth pillar of good laboratory practice is the comparatively of the monitoring procedures, the mutual trust is achieved, and the mutual acceptance of safety test data will be possible. Right. So mutual trust means that the internal liaison arrangement, liaison understanding, the trusting into the laboratory that they are going to fulfill that what do you call, what has been the what the guidelines has been issued accordingly, right? So this is the body which is going to monitor all these things. Where can GLP be profitably applied? Where? Which is the place where this laboratory practice can be applied? The term good laboratory practice is restricted to apply to such test facilities only, which are performing human health and environmental safety studies. In yesterday class also we discussed that studies which furthermore have to be submitted to the regulatory agencies for assessment. It is evident that not every laboratory would fulfill these conditions. That's what whenever the laboratory will start performing their work, they need to bother about the human health and environmental safety, whatever the drainage, whatever the disposals, whatever the extraneous material it is coming out from the industry, where they are dumping, where whatever the release it is coming from industry, whether it is going to harmful for the environment or not, at any level, at soil level, at water level, at human level, at animal level, at insect level, at any level, or at the same time at the human health, maybe in inhaling up the those harmful gases, inhaling up the those, or drinking up the harmful water, or whatever it may be, right? So that's what this everything has to be submitted to the regulatory agency for assessment, that this much in the month of January, this much release of the fume has been released into the what do you call air. So in that the percentage of carbon dioxide, the percentage of nitrogen, the percentage of other gases, it was that much, and the percentage of carbon fumes, it was that much, which is below the danger level, or it is not going to harmful if the people surrounding the industry or laboratory, they are breathing that particular gas, it is not going to harm their lungs, their other body organs in that level, or at the same time it is also not going to harm to the other animals. So like that they are submitting the report, and those report, whether these they have submitted the actual one or that is false one, that also need to be cross verified by the body. That's what the any laboratory which are comes under the risk, like leather industries, like paper industries, like pharmaceutical industries, those who are dealing with the harmful chemical, dealing with the harmful burnings, that industry where that place, definitely they are supposed to follow the GLP practice, right? The second paragraph told that outside the field of non-clinical human health and environmental safety testing, where GLP has to apply, official recognition should be based on the quality standards other than GLP. Since GLP is absolutely confined to the side said area, so wherever it the area has been told that here the GLP should be applied, right? So it should have its own official recognition on the respect of quality standard. And non-clinical human health, non-clinical human health means sometimes the particular human beings, those who are employed in the labs or in the surrounding area, they may not show any types of symptoms or clinical symptoms, right? But at the same time they will be getting harm from these outlets, it is coming out from the industry. So all those things we need to consider, and the labs which are dealing with the toxic chemicals, toxic disposals, they are definitely they need to follow the guidelines, so that the we can save the human as well as environment. Basic principles of good laboratory practice. The important principles are not new, nor they nor are they unknown. They can be summarized as follows. The first one, there should be a unique identification for the study and all of its parts. Whatever the parts or department it is being working in the under the labs, they should be the having the unique identification, the brand they should have, so that by that this particular company definitely they are following the good laboratory practice. So these are the standard company. So likewise we are going to separate the industries, the laboratories, so that they can follow the they can have their unique identification. The second line, all original observations in a study should be immediately, clearly, and legibly recorded, right? So it has to be recorded, whether it is by the CCTV camera, by the other types of camera, by the documents register writing, by the entering into the register, by the having online database, by feeding the data's ongoing process data into the computers, into the other electronic devices. It should have their own record, so that we can go through what happened in past, which day, which month, which year, right? Even for the small colleges or small organization also, they will be having record for at least for 3 year or 5 year. So that's what the third principle suggests, that all records should be in the form of bound notebooks or on continuously numbered sheet, right? That's for recording also given the guidelines here. Bound notebooks, right? It has to be how, if you go to the any, for example, if you go to the NIPER or IICT, what happened generally, while entering into the security gate only, they will be writing the details like your name, your phone number, what time you are entering into the lab, and what time you are coming out, in time, out time, right? So, and even in colleges also, when you are going to perform any machine like HPLC or FTIR or any other types of, there will be the logbook. In the logbook, who is the person is going to operate the machines or instrument, that the name you are writing, and what time you started, what purpose you have used that machines, and what time you switched off or out time, that you are noting down. So likewise, the same thing it happened into the labs also, right? You need to enter the things what you are going, that's what, so that it will be as a record for the future reference. All entries and corrections to them should be dated and initiated, right? You need to sign there, and you have to write the date, which date you have done this particular work, and what was the time. Everything has to be entered. Records related to the test system itself should be gathered and retained, right? It has to be compiled properly, whatever the record has been done for any types of proceedings, and it has to be keep kept into the office properly and arranged properly, and it has to be there. We are not supposed to discard them until and unless it is too old, right? For there is also guidelines how long you are supposed to, actually it should be right from when your laboratory established, from that time onwards till today. The main thing, at least some records may be discarded and discardable after few times or after certain times, right? For there is also time limit period has been given by the bodies, right? The next one, the specimens should be clearly identified so as to allow full traceability, right? So that much transparency supposed to be maintained, so that it can be traceable, right? At January 2019, 15th January, on the day of Monday at 2 p.m., with this particular high performance liquid chromatography, which type of sample has been loaded, and what kind of solvent has been used, what was the elutes, what kind of pressure has been applied. So this much details, if you go to the flashback or into the past, we will be able to trace. That much transparency supposed to be maintained. At the end of the study, all raw data should be assembled, the cataloged and achieved, right? So all the raw data in the sense what has been written, right? Like just now, if you take the example of chromatography, so what was the sample, whether it was the plant extract, whether it was the pure sample, whether it was the phytochemical, whether it was the any established isolates, what sample you have loaded onto that, what was the solvent system, whether it is for alkaloid, whether it was for the glycoside, so like n-hexane, butane, and water, how much ratio. So everything should be, raw data should be recorded, and it should be assembled, and it should be stored into their database, so that it can be retainable, or it can be traceable, and in the future. The GLP principles are much more demanding in the this respect, and in the section on the conduct of the study, the following instructions are given for a recording of data, right? So that's what conduct of the study, right? In this section, in the section on the conduct of the study, that has to be having demanding in the respect of, that's what, all the data generated during the conduct of the study should be recorded directly, promptly, accurately, and legally. So directly means in the sense what time it has started, and immediately it has to be promptly, spontaneously. It do you don't give the times that I will record in evening. Now I'm having full work. I'm busy, so let it be. Because further you are going to be busy if you are working in the lab, and you will not be able to recall the things once again when it will be passed. So that's what it has mentioned, promptly or immediately, right? Accurately means what has been, whether it is, don't try to manipulate the data. Don't try to, if the system is giving the error, if the instrument is giving any kinds of error or some disturbance you are feeling over there, you need to record that only. No, don't try to manipulate, because if you will not project the right thing, the proper disturbance or the error which is occurred in your process, in with your raw material or with your machine, that you will not going to trace out. These entries should be signed and the initialed and dated, the date, the signature, and everything has to be done, who has recorded this data and what time, that has to be there. The possibilities inherent in the applicable control mechanisms might subsequently provide the means of judging the shortcomings of the present activities and for improving the scientific quality of the future work, right? So that's what we need to understand, that what is the type of improvement in scientific quality in future work that is going to be happen, right? So the next one, these are the references: laboratory, good laboratory practice, the why and the how by Judge P. Seller. He was given in that, from there it has been taken. So here we completed the four pillars of the good laboratory practice, that is very important to have the record in that. So